Welcome back to Healthy Living, brought to you by St. Tammany Health System. We're talking today about population health and some home-based solutions that help us to improve the health and lives of people who live in our community. We spoke first with Dr. Michael Hill, and he talked about population health. Up next, we're talking with Gabby Silva, who is going to teach us about transitional care. Gabby, welcome to the show.
Thank you very much for having me.
Really excited to have you here and to learn about transitional care, because Dr. Hill referred a little bit to it in his segment, but I think transitional care feels like a little bit of a blind spot for a lot of people. We don't even realize this is an aspect of health care. When you get out of the hospital, you've been discharged from care, you're headed home, you're not sick enough to require home health care or to be admitted into a long-term care facility or a rehab facility, but maybe you need some help in the middle. And so if you can, talk to us first about what is transitional care.
Okay. Well, traditionally, what transitional care was, it was more of an outpatient clinic. And historically, patients would come from the hospital, they would go home, they would be discharged, and they would go to a clinic to review their discharge instructions or medications and things like that. But with all the other appointments that they have to make, you know, we changed the program, several years ago. It was changed so that now we're going out to the patient's home, or we're calling them, within 2 days of them being discharged, and we're making sure that they have everything that they need in their home in order to be successful and make sure that they don't have to go back to the hospital.
Well, and I think that's what's really beautiful about it. You're recognizing that the hospital was able to get this patient through a surgery or whatever procedure took them into the hospital in the first place and get them well enough to be discharged home. But then there are follow-up responsibilities that patient needs to make. They need to see certain specialists or maybe their primary care. And you can ensure that they get those things done, and you can help them not wind up back in the hospital again, which is so important for their their longevity,
right,
and their overall long-term health.
Right. The way that I like to put it is, the patient is discharged from the hospital, and once they're home, they don't know where to start. They have to go to their cardiologist or to primary care, pulmonology, nephrology. Where do they start? So in a way, we're bringing our information in, and we are making sure that we're aligning them in the right direction. We want to make sure that they do follow up with all of their providers, they take all their medications appropriately, and take a little bit of that burden away from them of doing it by themselves. And ultimately, if they're discharged from the hospital and we see that they do need a little more extra care, we can also help with getting that referral to, home health, or for home sitters, a referral for food in the community. If they're not able to eat, they're not able to take care of themselves at home. So.
And I think that brings up that interesting point Dr. Hill was referring to. He talked about, if you look at healthcare as a pie chart, only 20% of healthcare is really provided, at the hospital or the doctor's office or what have you. The other 80% is really in our own lives, in our homes, in our workplaces. How we go about our day-to-day life has impact on our health and well-being. And you just mentioned food insecurity, and I think that's something that we so often overlook and don't realize how many people may have fragile access to food. They may have income issues, they may live in an area where grocery stores are not abundant, and so you're suggesting then that as transitional care professionals, by not having transitional care in a clinic, but in the home, you are able to see some of those social determinants.
Correct.
That help to determine how healthy this patient is going to wind up over their lifetime.
Very, very true. I mean, some people don't have transportation at all. If they're calling the ambulance to take them to the hospital, then how are they going to get to their primary care doctor? So how are they going to go to the grocery store? How are they going to go to the pharmacy to pick up their medication. So thankfully in the community we do have a lot of resources, to bring meals to the home. There are a lot of resources for, let's say, pharmacy to be delivered, medications to be delivered as well. So we have that information in transitional care, and what I love is being able to bring that information to the home, to the patient, and give them that peace of mind that, there's help out there that we can help you with.
That is beautiful. And one of the things that Dr. Hill mentioned was individualized care. And what I hear you saying is that's what you're able to do. You bring a toolkit of resources of what's available in our community that can help this patient. And you can go to their home to help them determine what are the best ways for them to get the food, the medication, the transportation that they need to get back to normal and get on with their life.
Right, and education as well. What I love to do is, when I get my appointment for my patient, I'll review the patient's chart or make sure, if they're going to the hospital several times for, let's say, congestive heart failure, has there been a time that the patient has absorbed the information of how to take care of themselves? So in the office, we have several materials where we can pull from and bring that tailored information to each patient and make sure that we walk through it with them, explain it to them, and kind of get their feet wet with, their own health care. If they don't know what they're doing, they don't know where to start, and we bring that information to them.
Well, and that's understandable. You have, healthcare can be so overwhelming when you don't understand what you need to do. And if you keep winding up back in the hospital for the same issues, then to be able to take that step back and examine the whole picture of a patient's life and home and help them to know what the resources are, but also what the actual lifestyle changes and decisions that need to be made are. So to talk to someone about quitting smoking, for example, and when you talk to them about eating right, to be able to understand how to get the resources to get that healthy food, right. So that they're not in a situation of either not having food at all or maybe having foods that are counterproductive in the home.
Right.
This is just fascinating because I love the idea that you're able to take the best practices that we know are what we should all be doing, but be able to sit down with an individual case and think about what among those best practices really apply to this person, and then to go visit with that person and maybe their family or loved one in the home.
Right.
Which I think really makes a difference, because then as the patient or as their family member, you're able to hear firsthand, for this patient, for me, myself, or for my loved one, these are the things that we need to accomplish so that we don't wind up back in the hospital again.
Right.
Gabby, this is really wonderful. I love this transitional care. Thank you for coming in to teach us about it.
I greatly appreciate it, and I just love going into the community and giving them that information and empowering them so that they feel successful outside the hospital.
That is beautiful. Thanks for coming in.
Thank you very much. I appreciate it.
You're watching Healthy Living, brought to you by St. Tammany Health System. We're talking today about population health and some home-based care solutions that help individuals in our community to lead healthy lives. We'll be right back.